Hi everyone, welcome back. This is the fifth and final video in the Put Your Breast Foot Forward video series. The topic of this video is common breastfeeding issues. In this video, I'm going to discuss 9 common issues that women face while they're breastfeeding. I'm going to include, when appropriate, some home troubleshooting and tips to try and solve these issues, again, if it's appropriate, and who to reach out to if you're having issues, who to contact. Just wanted to put in this disclaimer, please don't be alarmed by these issues. You may or may not experience these issues in your breastfeeding journey. I'm just presenting this information so that you're prepared in case you encounter one of these issues, that you'll be familiar with what the issue could possibly be. Many women don't have any of these issues, but it's still good to be aware of possible issues that may come. So the first issue we're going to discuss is clogged ducts or milk blebs. Clogged ducts, we talked about the ducts several times. It's basically where there's a blockage in your milk duct, and that causes insufficient drainage and the milk to basically build up behind the clog. There's a few different signs for a clogged duct. Usually it's kind of gradual that it comes on. You may have a tender lump. Usually you kind of feel sore and achy in a particular area of your breast. You may actually be able to feel a little bit of a lump. It may be tender. Keep in mind that the area should not be hot or red and this shouldn't cause you to have a fever. We're going to talk about what that might mean next. A milk bleb, which is a really funny word, it's similar to a clogged duct, but the clog is in the nipple area, and you actually might see a little bit of it looks like a white blister on the tip of your nipple, and usually that's kind of like just a clog right there in your nipple. So who do you reach out to if you think you have a clogged duct or milk bleb? You can reach out to your physician or a lactation consultant, and actually usually it's a good idea to reach out to them anyways to rule out mastitis, which we're going to talk about next. But there's a lot of strategies you can try at home to relieve this clog and basically get the clog out. And of course, these strategies are not to replace the advice of your medical professional. If they suggest or tell you to not do something, please listen to them and go with what their treatment plan for you is. The easiest and simplest way to remove a clogged duct is to feed your baby. Try not to go more than 3 hours between feeds. You can even offer your baby your breast more frequently, and you can try different positions. Some women try something called dangle feeding, which is where you lay your baby down on a bed and you actually lean over them and allows your breast to dangle over them. And sometimes I don't know if it's gravity or what exactly it is about that helps, but some women swear by that. So you might even just want to try a different position. Try the football hold, try sideline, try something else, just to see if baby can actually suck out and remove that clog themselves, because they do have a lot of, vacuum force going on. The other thing you can do is you can feed your baby on the affected side first, and that's because they're going to start off really strong, and that force again might dislodge the clog. You can also try massaging the area before and during feeding, or you can go into a warm shower and try massaging the area. You can try using your electric pump. You can use heat packs before and during a feed. You can also try with your haka. You can put in some hot, warm water and Epsom salt and attach your haka, and sometimes that helps draw out the clog. In general, you want to avoid tight bras because those can make you more prone to clogs. The other thing, and of course this needs to go along with a medical professional's approval and their dosing, but a lot of women take sunflower lecithin. It's a supplement, and that can help avoid clogs or even get a clog cleared out. But again, you need to ask your medical professional, and they need to tell you how much to take and how frequently and all that good stuff. But it's worth asking about if you're dealing with clogs. Now, I mentioned mastitis before. This is like when a clog goes wrong, and you already think something went wrong when you have a clogged duct, but this is like not a great situation, and this is a serious situation. Mastitis is inflammation of your breast tissue, and it can indicate an infection, but it's really like where your breast tissue is inflamed. Now, what does that mean? What does that look like? So your breasts may feel tender, and the big difference between mastitis and a clogged duct is that the area is going to feel warm or hot. You may see redness on your breast. You may be very swollen and have a larger breast lump. You may have significant pain or burning sensation. And you may feel ill. You may have a fever. If you develop a fever and you have any of these other symptoms, you need to reach out to your physician immediately. Like, if it's 10 o'clock at night, you need to try getting a hold of the on-call physician. Mastitis can get serious very quickly. And if you have redness or swelling or fever, that's why you need to contact your doctor immediately. It can lead to bigger issues, and this is not a condition to try and treat at home first. Now, of course, let's say you call either your on-call doc and they want you to try other things, and they may send in a script for antibiotics for you. You can try a lot of other things to help relieve it, but that should not be in place of getting your medical professionals help immediately. Another very common issue that women face with breastfeeding is sore nipples or blistering or chapped nipples. You're going to hear about this a lot from women. It's very common, especially when baby is a newborn. Although it's common, it's not normal. So if this is happening to you, there is something going on that may need to be addressed. This can be due to a bad latch or something that is called a tongue or lip tie. I am not going to get into tongue or lip ties, but this is what you need to know. It basically is a restriction on your baby's lip or tongue from being as flexible as it normally is. And when that happens, that can mess with baby's latch. They can't get as good of a latch. If you suspect this, contact your pediatrician or lactation consultant. The best thing to do, though, is to find a healthcare provider that is specialized in diagnosing lip or tongue ties. General pediatricians might not be super educated about diagnosing that. They may specialize in it. So it depends what you have in your area, what resources you have. Oftentimes a pediatric dentist is the best person to diagnose ties. So that's something that you kind of want to look into if that's something you suspect. You can also contact your lactation consultant if you need to help with your baby's latch. And just some strategies to prevent and help this issue is being vigilant about, given that you have ensured that baby has a good latch, be vigilant about using nipple cream after every feed. I did show in a previous video, there's lanolin cream, there's other creams that are like nipple creams, and they're made so that they're safe to use while you're breastfeeding. Just slather that stuff on your nipples after you're done feeding your newborn. Pop on a breast pad to keep it in place, and that will really help. There's also something called hydrogel nipple pads. This is what they look like, and these basically stick onto your nipple, and that can help keep them from drying out and getting chapped. And like I said before, make sure baby has a good latch. Refer to our latch video. Find a lactation consultant to help you out. You can try different positions if you're having trouble latching your baby. Just try and troubleshoot it that way. The next issue we're going to discuss is engorgement. Now we talked about what engorgement is before. It's when your breasts feel uncomfortably full. It's almost like when your stomach is bloated, but it's in your breasts. Your breasts feel bloated. They're full and uncomfortable. That can be, as we discussed before, due to your supply hasn't regulated yet. You may have an oversupply. Maybe baby slept longer than usual. Or maybe you're working on weaning your baby. You're stopping your breastfeeding journey and you're working on lowering your supply and getting your body used to not feeding your baby. So some strategies to prevent and help engorgement is feeding baby regularly if that's what you are intending to do. Try not to pump in addition to feeding baby unless you need to. That will help avoid an oversupply. And if you're struggling with an oversupply, contact a lactation consultant to troubleshoot. You can also pump or use your haka to manually express to relieve pressure. But be sure you don't do it too much. Again, breastfeeding is supply and demand. You can also use a warm washcloth while you're feeding your baby, put the heat on your breast, or take a warm shower. Some women prefer cool washcloths or cold compresses. One product that's really great is these breast pads, and as you can see, when you clip them, there's a hole in the middle. These are great when you're pumping. These are great to just throw on your bra when you're sore. They're not necessarily amazing to use while baby's feeding just because of the size opening, but you could certainly place them on your breast if you needed to. As you can see in this, there's these little gels, and you can either put these in the freezer for nice and cold, or you can put them in the microwave for some warm. So that's a great product, whether you're like hot or cold, for relief. Now, we did talk about getting a good latch and that painful latches or pain while feeding may happen. If you notice that you are having pain while feeding your baby, aside from the initial, that first latch and you're getting going, after 10-15 seconds, if you are continuing to have pain while feeding, it can be due to a poor latch. It could be due to thrush, which we'll talk about in a little bit, a clogged duct. You need to do some investigating, and that's because you deserve to have a pain-free experience, and usually pain indicates that there's something wrong. So contact your pediatrician or lactation consultant to try and figure out what the source of this pain is. Is it a latch? Is it another medical issue going on? Is it a tie like we discussed before? And again, really focus on getting that good latch. Don't let baby get lazy. Don't get lazy yourself. And make sure it's a good latch every time. One feeding with a bad latch can really make you feel sore for a while. And if you just take the extra time to make sure it's a good latch at the start, you're going to be thanking yourself. Like I said before, you can try different positions. The other thing that this picture depicts is a nipple shield. That is a plastic cover that goes over your nipple. Talk to a lactation consultant about this. They can guide you if this is a good thing to try for you. Sometimes babies can have difficulty, whether if they're premature or have a tie that you're waiting to revise. Sometimes the nipple shield can really save you a lot of grief. Another very common issue that women might face, and this is just an anatomical difference that women have. It's, I hate to use the word issue because it's just how you're built, is that if you might have inverted or flat nipples. And that basically means that your nipple doesn't face out or stick out from your breast as much as the average woman. And some women think this means they can't breastfeed, and that's false. Women can still breastfeed with inverted or flat nipples. It just might take a little bit more finesse and troubleshooting and seeing what works for you and your baby. Again, reach out to your lactation consultant. They can really help troubleshoot issues with latching baby on to your nipple. You can also try putting a cold compress on your nipple to help bring out the nipple before you start feeding your baby. You can try a nipple shield, which I just showed you in the slide before this. And you can also try starting your feed with a pump. And sometimes that will help pull the nipple out enough for baby to latch. Again, if you have an inverted or flat nipple situation, talk to the lactation consultant. They deal with it all the time. I mentioned before the concept of thrush. This poor little baby's got a bad case of thrush here in this picture. Thrush is a fungal infection. It can happen for the mother on their breast. It can also affect the baby's mouth because, of course, these are coming into contact for a lot of time during the day. So signs for the mother for thrush include you may have burning or itching of your nipple or breast. You may have intense pain in your nipples or breast during or after feedings. And again, that's why I mentioned if you're having sustained pain while you're feeding, to reach out to your healthcare provider and try and rule this out as a reason. Your nipples may be very red. They may look flaky or blistered or cracked. You might even have a rash. So if you have any of those symptoms, reach out to your doc and see if it could be thrush. And then signs for baby include the white patches in their mouth, on their cheeks, or in their cheeks, on their gums, on their tongue. And as you can see, this is an extreme picture of thrush. Of note, babies' tongues will be a little white after you feed them anyways. That's because they just drank milk and milk is white. But the kind of quintessential thrush sign is that you can't wipe away that whiteness off of their tongue. Babies might also have cracked skin in the corners of their mouth or be really fussy during feedings. Thrush is painful for them too. So if you suspect thrush, you definitely, in either you or your baby, you need to contact your doctor and your baby's pediatrician. If you suspect either of you has thrush, because obviously there's a lot of exchange time between your nipple and the baby's mouth. You both will end up needing to get treated if one of you has it. You may be prescribed an oral or topical medication to help clear up the infection. And thrush is easily spread, so like I said, you both need to be treated. Your doctor or baby's pediatrician will give you very specific instructions about how to treat the infection, what to wash, how often to wash, what to wash in hot water, like thinking bras, breast pads, nipples on the bottle, passies, like they will give you very specific instructions about how to treat the infection. Now, there are things that you can do to prevent or to help this infection from happening. Of course, like I said, if you suspect it, contact your doctors first and listen to what they're telling you. But you can prevent this issue from happening or try to prevent it by changing your nipple pads frequently if you're using nipple pads. Changing your bras frequently, wear clean bras, make sure you wash your bras, try and shower daily. I know it's really hard with newborns to get that time to do that, but really try and do that. And make sure you wash and sterilize baby's pacifiers and bottle nipples, and store milk appropriately. Now, we've done a lot of talking about oversupply, but it is an issue that can be difficult for moms to go through. As we said before in a previous video, it's when you make more milk than baby needs. It can cause a lot of discomfort and engorgement. It can cause clogged ducts. It can make women more prone to mastitis. So oversupply is something that if you think you have an oversupply or you're facing these types of issues a lot, that might be an indication that you do have an oversupply. So if you suspect an oversupply, you really do want to reach out to your lactation consultant to confirm this, have them evaluate you, and they can come up with a treatment plan and find ways to decrease your supply while still maintaining it enough for baby and alleviating the discomfort for you. And we've mentioned all these things before to, strategies to prevent and help an oversupply. Wait to start pumping until your milk supply is regulated and established. Don't pump in addition to what baby is eating unless you need to for some reason. And if you are pumping a lot, try and gradually decrease the amount of time that you're pumping. If you have an oversupply, that may be a strategy that the lactation consultant recommends. Again, don't do this unless a lactation consultant recommends it. If you're feeling very full, like I mentioned before, really full and gorged, manually express milk just enough to feel comfortable, but avoid emptying that breast because then your breasts are going to think you need to make a lot of milk. The last thing I want to talk about, and of course I haven't really mentioned partners a lot in this video yet, but I'll make up for it now. A very common issue that women face when they breastfeed is lack of emotional support. And I think I mentioned this in the first video, support for a breastfeeding mom is so vital for them to feel successful in their breastfeeding experience. Lack of emotional support can really take a toll on a woman's success with breastfeeding. Breastfeeding can have ups and downs. There's long nights and tough days, but that's just having a baby. It's not, it may be because of breastfeeding, but you're going to have tough days with babies anyways. And breastfeeding can have its ups and downs. So if you don't have that support, if you don't have a supportive partner, if you don't have supportive family members or friends, first of all, have them watch these videos. Maybe this will change their tune a little bit about their view of breastfeeding. And if your partner, family member, or friend who is on the fence about breastfeeding isn't gross. We just went over all these amazing things about breastfeeding, how it's really important for your baby, and just know that it means a lot. The communication that's coming from you to this mom is very important and meaningful. Now, obviously, there may still be some partners and support people out there that aren't supportive. If that's the case, seek out other sources of support. There's support groups for mothers who are breastfeeding. Maybe find a mommy group in your neighborhood or your town and surround yourself with other people who are breastfeeding, and that can be like the most encouraging thing to you, just to know that other people are going through the same exact thing. You can find these groups online. I know COVID is very restrictive right now for people. You can find chat rooms, support groups, Facebook groups. You can look through La Leche League, or your local hospital might offer support groups too for breastfeeding. And partners and support people, hopefully after watching these videos, you understand how great breastfeeding is and how important it is. I, again, can't stress enough, partner and family support is so big. Even you're not the one who's pumping the milk and feeding the baby, from your breast, but you're still a really big part of the whole process. Offer encouragement to the mom. Offer whatever support you can provide, even like a simple, you're doing a great job, even when it's really hard day, that can make a huge difference. And keep in mind too that moms may experience other people trying to shame them for breastfeeding. These experiences come from really random places sometimes. Sometimes you might be feeding your baby in public and someone says something like go in the bathroom to do that or whatever. Sometimes you're just taken aback by it and you don't even know what to say in the moment. But partners, that's a great time to step in and say, hey, this is not your business. Look away if it bothers you, whatever you need to say. And that can be helpful to mom too. So yeah, I think emotional support is huge. So that's all for this video and video series. I hope that you learned a lot about breastfeeding, and I really hope that this information has made you moms more confident breastfeeding, and you partners and support people out there feel more confident in supporting a mom breastfeeding. We did cover a lot of information, and there's still a lot more information out there about breastfeeding. There's a lot of things that we didn't cover in detail. And just keep in mind that each experience is different. Each mother and baby are unique. So you may need to do a little bit more digging into information if you have more questions. If you do want to explore more information about breastfeeding, there's a couple of great resources here that I've listed. Healthychildren.org is created by the American Academy of Pediatrics. They have tons of educational information. Their articles are pretty short, easy to read, great stuff there. They have a lot of information about breastfeeding. La Leche League International is also a huge breastfeeding group, and they have some great articles as well. And then, of course, the CDC website I actually mentioned before, breast milk storage guidelines, but they also have a lot of really interesting information about breastfeeding, statistics, that kind of stuff. So I thank you for joining me through this video series. Again, I hope it was helpful for you. Please don't forget to fill out the survey that is included in the description of the video. And thanks again. I hope you learned a lot, and have a great day.